Brachytherapy is a form of radiotherapy. It is putting radioactive sources directly into the cancer itself or very close to the cancer, thereby delivering high doses of radiation to the cancer and yet minimizing the radiation dose to the healthy surrounding organs. There are two forms of brachytherapy. One is high-dose rate or HDR brachytherapy, where the radioactive sources used are quite intense and therefore can only be applied to the patient temporarily and needs to be removed after the treatment. The other is called low-dose rate or LDR brachytherapy, where the radioactive sources are actually left permanently in the patient. They do lose their radioactivity over time, and therefore it eventually becomes non-radioactive. To deliver brachytherapy, we first need to create a channel into the cancer itself so that the radioactive sources can reach there. And this is done with various sorts of applicators. The sort of applicators used depends on what sort of cancer we're treating. For example, with prostate HDR brachytherapy, the applicators come in the form of very fine, thin catheters, little straws that's inserted into the prostate. This is usually inserted under general anesthetic for patient comfort and also done in an operating theatre so that it's done in a controlled environment and safe for the patient. Once all the catheters are inserted, the patient then has a CT scan so that we can accurately locate where these catheters are within the cancer and its relative distance to healthy tissues nearby. All this information is then entered into a computer system and then the dose calculated. So each treatment plan is actually tailor-made for that patient and for that cancer. Once the treatment plan is completed, then the patient would then go on to have the treatment. The treatment is carried out in a specially designed room down in our department. It's pain-free and takes only 15 to 20 minutes. Most patients would require more than one session of treatment. For example, with prostate brachytherapy, they would have one treatment on the day of applicator insertion and another one the next morning. The applicators would then be removed immediately after, and the patients are discharged a few hours after that. So for most brachytherapy patients for prostate cancer, it's just an overnight stay for the patient. At your initial consultation with your radiation oncologist will discuss with you the pros and cons of brachytherapy and would advise whether brachytherapy is suitable in that particular case. As a general rule, brachytherapy is commonly used in prostate cancers, either low-dose rate or high-dose rate brachytherapy, and also in gynecological cancers like cervix cancers and uterine cancers. After brachytherapy, we would usually recommend regular follow-ups with the radiation oncologist, primarily to allow the patients to discuss any concerns they may have and also to ensure a good post-treatment progress. With prostate cancer, for example, we would usually also do a PSA testing with each follow-up and also a questionnaire to monitor how the symptoms are going in terms of urinary symptoms and rectal symptoms. With low-dose rate brachytherapy for prostate cancer, no further sessions of treatment would be required because the radioactive seeds are permanently implanted while they are under general anesthetic in the operating theatre, and most patients will be fine for discharge the following morning.
I was admitted to the stand one afternoon, and that evening I was taken down and for brachytherapy. The first step was the stitching of a grid to my nether regions. All of that's under anesthesia, so I didn't feel a thing really. A bit of discomfort when I woke up, but actually no pain. And then we had one treatment that evening, another treatment the following morning, and one the following afternoon. The staff were very professional and very friendly and very encouraging. After the brachytherapy treatment, I had a 5-week course of external radiation beam therapy at the unit. I was extremely happy with the level of care I received.
Any questions we had were answered absolutely clearly and straight to the point. There was no messing about. We were reassured at every point, and we found the care and the help that we had there was quite brilliant.